Thank you everyone for joining. I'm just going to introduce myself. I am Bracha Banian, family nurse practitioner and CEO of IV Drips and Hello Dose. And with us today, we have Marianne Cohen. She is a psychotherapist who also specializes in emotional eating. She coined the term emotional eating, and she deals with clients who are struggling with eating and emotions. And I'm really excited to have you on today.
Right.
So, just for everyone to know that this webinar is completely confidential, so nobody sees who's on it. And if you ask any questions, you could just ask it in the chat box. We are going to spend the last 15 minutes answering questions. So as we're talking, if you have any questions that you want to ask or add in, then just feel free to add it in the chat box or in the Q&A. So I just want to give a little bit of a background about Ozempic and GLP-1s, Mounjaro. These are peptides that we have in our body, but were created to essentially last longer to help us have a sense of fullness. These medications were originally created for helping people manage their sugar, diabetes. We found it through something called the Gila monster. And then we extended the life of these peptides that we naturally have in our body to extend and make us feel full for longer, slow down our GI tract. But we started noticing that these medications are not just about weight loss. While most people know about them for weight loss, they actually have a lot of other benefits because of the things that they're doing. Now, Bloomberg put out an article last year talking about how the CEO of Walmart has seen a substantial decrease in his food sales department due to GLP-1s, which is basically coming to prove to us that GLP-1s are not just going to change the weight loss industry, it's going to change economy and healthcare as we know it, because less people are now buying junk foods. And with that, we are going to see many other changes in our entire society. It's a very controversial topic, which is why I brought Marianne Cohen here today, because we think about these medications, and a lot of us originally say, hey, that's bad. It's not a good thing. It's causing you not to eat. And eating is an emotional decision many times. And, there's times that it probably should be emotional, and sometimes it should be logical. But, what about if we take that emotion away from people? How is it going to affect our lives? And should it be taken away? And so we want to have a little bit of a discussion when we're talking about the emotional aspect to eating. And will these medications benefit or potentially harm people who are struggling with whether it's an eating disorder, whether it's binge eating, bulimia, anorexia, whether it's just trying to navigate your feelings and understand how these how these medications play a role when we are taking them. Is it going to help us in the food eating industry, or is it going to harm us? And that's this conversation that we want to have. Feel free again to ask any questions as we talk about it. And Marianne Cohen.
Hi, it's good to be here. I want to say up front that I'm going to be talking about case examples from my practice, names, and identifying data I've changed for confidentiality. So when people hear Bracha talk about the health benefits of these medications, that they're not just weight loss, people don't hear that. They hear weight loss, yay, sign me up. But here's the thing, as a psychotherapist, we have to be very attuned to the fact that most people who come for these medications to lose weight are emotional eaters. They eat out of stress, boredom, anxiety, depression, procrastination, sexual tension, you name the emotion. And if people cannot, for whatever reason, we'll get into this later, face it directly, they turn to food. Food is a good distraction. Food is a deterrent from feeling a lot of feelings. And so the journey of Ozempic, GLP-1s, is not only physiological, it's also psychological. So I'm here to tell you some examples that were very surprising, some of them for me, about what happened when some of my patients began on these medications, because let's remember, emotional eating is a coping mechanism. It helps people cope. So now let's say your hunger is reduced when you take the injections, and you don't have your way of comforting yourself. The food is not as important to you. How are you going to comfort yourself? So when we strip away the comfort from people, they find out that there are underlying emotions which they may know about or they may not have known about. So should I give you the most dramatic example?
No,
I think I'll give you the most dramatic example because it's really surprised me. I had a patient who actually had gastric bypass and then went on Ozempic. I've had a few people. They didn't feel that the gastric bypass really put it over the top for them, so they went on Ozempic. So I had this patient who was losing weight. And let me just add, when you lose weight, it's not just that you have to cope with emotions by yourself, but there are people in your life who are going to have reactions to the fact that you're losing weight. So this was a very startling example. A patient of mine lost a lot of weight, and her husband began to think she was having an affair. And he began accusing her of having an affair, which she wasn't. As a matter of fact, the affair she had been having with food, she wasn't having anymore. And that was the only affair, and she wasn't having it. He would wake her up in the middle of the night, questioning her and questioning her. And she was so proud of having worked with me and work out a lot of emotional stuff, but her husband, not so much. He had a psychotic break. This is my worst case scenario nightmare.
wow.
He needed to be hospitalized. Then he got into the belief that not only was she having an affair, but the computers were FBI agents who were interested in her, his wife. Anyway, the marriage broke up, not because of anything she was doing. She was a success. But he had such a strong reaction, whatever that was for him. I think I know, but I'm not his therapist. I'm not going to say. So I'm giving you the most horrific example just to say that emotions come to the people who are in relationships with you. I'll give you another example, not so dramatic. And this ties into shame, which we'll get to later. I had a patient who did not want her husband to know she was on it. Why? Well, if it doesn't work, I don't want him to accuse me of having spent all this money. If it doesn't work, I don't want him to eye me like a hawk if I have a cookie or something he thinks isn't right. She taped the Ozempic pens into her vegetable crisper in her refrigerator. So it opens up the question. This is not just Ozempic pens that we're talking about. This is about a relationship between a husband and wife and the fact that vulnerability was something she was guarding against to the point of hiding this from her husband. Now, I appreciated her wish to do that in a way. She had tried losing weight for like 30 years and it wasn't working. And she didn't want him to be part of this dialogue. She wanted it to be a monologue with her and herself and her body. Hopefully, I think, it'd be interesting what other people think, that she will be able to tell him. And it will open up a conversation about why she couldn't tell him.
Yeah.
So that's another example. Do you want to comment on that?
Yeah, I think well, we see it in our practice all the time. We have, even mothers and daughters on it, and they hide from their daughters that, they tell their daughters to go on it, but they don't want to tell their daughters that they're on it. and husband and wife all the time. There's a lot of shame to these medications, and I think it comes a big part of it comes down to because it's almost as if people blame themselves why they couldn't lose the weight, and it's a failure on their part, which essentially comes down to if we all understood the science about why it's hard to lose weight, then we'd really learn
Mm,
to say, hey, it's not your fault. There's like, there's biology, and we can go, this will be for a different webinar, but there's like
right.
biology, there's psychology,
Genetic.
emotional eating, there's genetics, there's, deep rooted things that it's like saying to someone, all the different things that you're working on in your life, like why you react to certain people, why you like certain people. You cannot be embarrassed, or ashamed of it, if you are attracted to a certain, let's say, trait in a spouse or a partner. Can't be embarrassed of it. It's part of like your genetics, your biology, all those things. And it's the same type of thing when it comes to weight loss. It's so much deeper than willpower, which is, what Ozempic taught us. And there's no shame in that. It's just a part of life. And so,
But I think I agree with you, but I also think fat, real or imagined, fat, real or imagined, and females is a really big story
yeah,
because part of the shame is what people do in private and in secrecy with food. And it's like the fat is telling on them. And so secrecy is woven into this. And fat means, as you said, there's something wrong with me because I can't control myself.
yeah,
And therefore, I often say to patients, well, what do you think your fat says about you? What's the worst thing you think other people are going to take from your being overweight or you thinking you're overweight? And I'm a glutton. And of course, women fat needs, neediness, dependence, satiation. It's all wrapped up in this bundle of being women, particularly because I don't see that men have as much shame. I don't know if that's your opinion, but the men I've worked with are much more because they don't feel it's about a weakness of them. They don't feel it's about them.
yeah, yeah,
Women, not so much.
yeah, yeah. There's probably more emotional eating with women than with
Right,
men. Yeah.
right.
And and another thing that on top of this, emotional eating, it's that what GLP-1s are doing, in my opinion, are, certain times in life we think if we have something, we'll be happy, right? If I have $1 million, I'll be happy. If I find the perfect husband, I'll be happy. If I buy that house, if I have the kids, if my kids do this, I will be happy. So once I get that, I know I'll be happy. And we think the same thing a lot of times. Like once I'm thinner, once I'm a size this, once like could fit into the same group as all my friends, and I'm gonna be fitting into these outfits, I'll just be so much happier when I go out. My life will be perfect if I just have this image of how I should be looking. I'll be happier. And what happens is, I mean, there's no drug that's gonna give you $1 million, and there's no drug that's gonna give you a husband. At least I don't know about it. And so, um, and so there's a drug now that helps you lose weight. And it's the first thing ever that said, here, take it. Are you happy now? And we're
Yeah,
realizing that, oh, it wasn't that. I mean, there are some cases, like actually there are some cases where people are happier because of the weight loss. But I'm talking about when we're the deep rooted about emotional, what's going on inside your body, on an emotional level, that people are getting thinner and they're starting to say, 1 second, I'm looking in the mirror and I'm still not happy. And I thought that if I was this size, and so I just wanted to touch on that and how you feel that, because I feel like it's actually going to bring more people to look in the mirror and say, this was fixing one part of my life, but it actually wasn't fixing the other part, which is
Right.
why I think that when people go on GLP-1s, they need to be a part of a big medical team.
Weight loss is only about weight loss. It doesn't fix your dissatisfaction with yourself. It doesn't fix a low self-esteem. Now, when people lose weight, they often feel better. But the question that you're bringing up, which I think is a fabulous question, is, do we ever get there? Do we ever lose enough weight to say, now I'm perfect? Well, the story of the anorexic proves to us that that is not the case. The anorexic can weigh 55 pounds and still feel fat. So the psychological dimension really is the name of the game for her, because no amount of weight loss is ever good enough, which, by the way, my opinion is anorexics should not be on this medication. They would never know when to stop. The New York Times had an article about that. I found it very credible. The anorexic will say, great, I lost 50 pounds, let me lose another 50. I'm exaggerating.
Yeah.
But it talks to your point. When is enough enough? And do we all want to be chicks on sticks? Because our society says we should, we do, that's what we want. I find it so interesting that after people lose weight and their marriage still is unhappy, and their son is still into drugs, and their mother, who all this woman's life told her daughter, you gotta lose weight, you gotta lose weight. And then when she does, the mother says, I think you've lost too much weight. I think it's time to gain weight. So is this really about her weight? Or is this about mama and control and separation and owning her own body?
Yeah. Do you think, like, what are you seeing in your practice actually? Because are you seeing more of a shift of people going on GLP-1 starting to now work on their the inner work more or faster? Almost as if, if you had depression, you went on antidepressants and then you're able to really focus on what's
Right,
in front of
right,
you. Are
right.
you seeing that people are actually starting to look in the mirror when they go on GLP-1s? If anything, it's helping them become closer.
Yes and no.
Okay.
Yes, if they were feeling ready, if they were feeling like it was on the back burner and now I could move it to the front burner of an issue I want to work on. But I've said to people, and I think we talked about this in the first webinar we did, if you're not worried anymore about what you weigh, what's the next thing that's going to come up for you? And I think it's an important question, because I'm opening up the curiosity for somebody. If you are an emotional eater, let's talk about the next thing that will come up for you. One woman said, came out of her mouth like that, divorcing my husband. And we both laughed because it was so, it just came out of her. She said, but I'm really scared. I don't really want to talk about it. Whenever I was binging on chocolate chip cookies, I wasn't thinking about how unhappy I am with him. But now that you're asking me what's the next issue to come up, but it came right out. But then there was this girl I talked about, I think in the last webinar, who really touched me a lot. She said, if I'm not binging and throwing up, I'm going to have to face the sexual abuse by my grandfather. And you know what? I'm not ready to face it. And you know what? I'm not ready to take this medication, because if it's going to calm me down and I have to have the thoughts in my head that I don't want to deal with, I realize I don't want it. I was so proud of her for being able to identify that she wasn't ready. It was valid. There was so
Yeah.
much more work she needed to do on the fear and the shame, the self-blame, and
Yeah.
everything that meant to her.
Yeah. We spend so much time thinking this cycle of like emotional eating, we're spending a lot of time thinking about the food because it's like a comfort. And so when it suppresses those thoughts, the GLP-1s or GIPs, Ozempic, Mounjaro, tirzepatide, semaglutide, when it suppresses those thoughts, then now we have space for other thoughts. And
Exactly.
then I almost look at it as like going on antidepressants, or if someone's like addicted to a drug and then you go to rehab, right? It's when you go to rehab and you're working on it, first we take you away from the drug, and then we start doing the inner work. And like sometimes they actually go hand in hand. And so I think there's actually going to be a breakthrough that people may actually start shifting a little bit more to start bringing up what's actually the reason beyond the emotional, beyond the eating, what is, and at the same time, fixing both. You're fixing both at the same
Right.
time.
I think we need to say that sometimes people need to be educated, that there are emotional reasons. If you've been so successful at eating your emotions, you may not know that you're doing that for emotional reasons. So I think
Yeah,
there's a piece of psychoeducational work that we
yeah,
need to do with our patients.
yeah,
I always say awareness plus action equals results. So if people just take action, just take the injections, for instance, and they have emotional issues, it's not going to do the trick. Or if they just go to therapy and they work on whatever, they need to couple it, the awareness, with some action, some behavioral action in order to have the result.
yeah.
So I want to ask you a question, and I sort of wanted to throw it out to the audience if you feel it's appropriate. A colleague of mine talked about a girl who was in very, very severe treatment or very rigorous treatment for very severe anorexia. At the same time, the girl lived at home. Her mother had the Ozempic injections in the refrigerator for herself. The mother was of average weight. And so my colleague came to me with this story and said, "What do you make of it?" And I think it's a fascinating question. What do we make of it? This girl had an urgency to lose weight through her anorexia. The mother had an urgency to lose weight, even though she was of normal weight. But it speaks to the fact that sometimes there are even family dynamics, the whole
Mm,
family. So I found that like a really stimulating food for thought
yeah,
about how
yeah,
you tackle the meaning of eating and weight loss in this family constellation.
yeah,
Girl was having so much treatment while watching her mother. This was not the woman who hid the things under her zucchini in the vegetable bin. This was someone else. And this was really fascinating to me.
yeah.
And the messages that we get growing up
Yeah, I
about,
can imagine how
yeah,
that's affecting the daughter's mental health. Yeah, by seeing that. Yeah. I just want to comment that someone asked if we can hear them, but no, everyone's on mute. And again, you could ask any questions or comment as we go. You can make it anonymous or public, but nobody could see who's on the panel or hear you. So, yeah. And I think I think as people are learning a little bit more about why people gain weight, and it's so multifactorial, meaning there's genetics, there's biology, there's hormone, right? We didn't even touch on hormones, weight gain that happens during postmenopause, perimenopause, and it's completely not a woman's fault. And it's just part of like your body changing. And then there's culture. And again, I I read a book called The Magic Pill, and he talks about how there's a lot of females who um had sexual abuse while they were younger, and now they eat to make themselves feel safe. Um, and I'm sure that you've seen that in your practice, but it could be that someone doesn't even realize they're doing that. And so when you're talking about willpower, you're thinking about your body on a psychological level, which we do all the time, tries to protect you. We do this all the time without realizing it. We put ourselves in situations or avoid certain situations because we're trying to protect ourselves. And so, that could be happening. And so there's so many deep rooted levels to why someone gains weight. And it's not as simple as calories in, calories out. Yeah. And hopefully that takes away shame from people as they decide to go on these medications to help them with their health and weight loss journey.
One of the things that I struggle with a lot as a therapist is that most of my colleagues are very much against these medications.
Yeah.
And I stand alone
Yeah.
in believing that for some people, they are really helpful.
Yeah.
But here, I went to a webinar last week by two nutritionists who were making fun and mocking Oprah, who now is on these medications and very honest about how much better she feels. But it shocked me that these professional people who were giving a webinar were making fun of her and that she had been hospitalized and she probably had gastroparesis, but she wasn't telling anybody. I'm kind of horrified. And then they ended it with, of course, everybody has body autonomy and everybody's allowed to do what they want, but hopefully they won't go for the medication. That's how they ended it.
Yeah.
So I feel like an outsider in my own profession. And here's the crux of it. There are many reputable people who believe that obesity is a chronic, relapsing illness.
Yeah.
And there are many people who believe, no, it's not. And you can't call it an illness because then you're stigmatizing somebody.
Yeah.
And I finished reading this book called The New Food Fights, and the authors talk about this push and pull. Are these people chronically managing a disease called obesity,
Yeah.
or are they not? And they're being
Yeah.
stigmatized by calling it a disease. So I came up with my own answer, but I'd much rather hear yours.
Yeah.
My
Yeah.
answer was it depends on the person.
Yeah. Um, okay, so this is a couple different things on this. So one, we've now more and more people are changing perspective, and I think this is going to be the new perspective. Chronic obesity is considered a diagnosis. So just like someone has diabetes or someone has, you know, any other disease process, rheumatoid arthritis, there's actually it's chronic obesity or obesity. It's a disease process, and that's how we look at it now, and that's how we view it. And it needs to be treatable. Now, and I spoke to many, whether it's actually gastric bypass surgeons or endocrinologists, and most of them view chronic obesity as a chronic condition, meaning if you have obesity, most of the times it's a chronic condition and you need to continue to be managed on it forever. Even if people who I did a podcast on this last week, even people who get the sleeve or gastric bypass, it will not last forever. They have to either get it again or go on a GLP-1. And so essentially what we're learning is that it's actually a disease that needs to be managed for the rest of their life. there are some people that won't have to, but majority of people will have to manage it. It's almost as like if you have hyperthyroidism, you likely have to manage it for the rest of your life. Doesn't mean that you're always going to have those levels that are not corrected, but it just may mean that your life, you're going to have to manage it. Type 1 diabetes, you have to manage it your whole life. And so that is the perspective that we take. But I just want to bring on another thing where, you said you went to this webinar, and what we don't understand is there's this book, it's called Fat Logic, and he talks about that we don't understand the amount of time it takes for us to start getting disease processes due to extra fat or extra glucose. The long time that is spent, our body essentially is protecting us for so long. You could essentially do wrong to your body for 20 years and it still will continue to be your best friend. I mean, think about it, if you're like in a toxic relationship where someone's abusing you and you stay and you serve it and you still give him supper, you still make him lunch or breakfast, still clean up the house, still take care of the kids for 20 years. And then you're like, I'm done. And when the time you say you're done, you're so done. And then you have all this emotional baggage that you have to unwrap.
Right,
Okay.
right.
Think about your bodies like that. It won't give up on you. It will stick with you and continue to do things. And I have a case where this guy said to me when he was about 50 years old, he said, when I turned 50, I got the diabetes, I got the high hemoglobin A1C, I got the cholesterol issues. Like 50s is the worst years. And I'm like, it's not, it's just that you chose to abuse your body for the past 20 years. And so when we talk about fat logic, because you have to understand the amount of time it takes for your body actually to start giving you feedback that what you did wasn't so cool. And you see these in your hemoglobin, you would see your cholesterol being high, your hypertension, diabetic, at risk for heart attack. All of these things happen, but it's only because of how you lived your life. And it's very hard for human behavior to change once you've been doing something for 20, 30 years. And I understand that people look at it and say, well, I'm overweight and I'm healthy because my labs are fine and I feel fine. But if you have visceral fat, which means fat around your organs, which first comes to your abdomen, your belly, it's a protruding belly. So that's like the first thing that you're going to see. That has been scientifically proven time and time again that it's going to dysregulate your metabolic health. And your metabolic health means all those different things, like how high your glucose is and how high your insulin level is and what your cholesterol level is and what your inflammatory markers is and what your blood pressure is. All of those things are, if those start getting dysregulated, but it first starts with visceral fat. And if you start having those things, it's directly correlated to longevity. It's directly correlated to how long you'll live for. And just because your blood work is fine, but if you start having fat, which means that you have so much glucose in your body that your cells don't know what to do with it, so it's storing fat. That is what's happening. And it's not about ego, and it's not about your self-worth, and it's not about anything else but the fact that there's too much glucose in the body, so your body stores it as fat. And when that happens, it goes around your organ, and then 20 years later, it's not good for you. We need to stop taking it so personal. It's not personal. It's just how our body works. And so while I do understand that there are people that have opinions that any size could be healthy, the science says otherwise. It says that no, actually it leads to heart attack, cancer, and a bunch of other disease processes. And so we take it too personal. We take, because what we spoke about earlier, because for the past 30 years, we have been told that diet and exercise is the treatment for losing weight. And when we were told that meant that it's on us. And so I have a different perspective on this than, and it's controversial and not everyone likes to hear it, but in the medical world, that's really our perspective. And it's hard.
You're saying that the body reaches a saturation point, and then these incipient disease processes kind of flourish. Like if you've been abusing your body over time, you may be fine, but it catches up. You reach the tipping point.
Correct.
So there is a group of fat activists, body positive people who do believe that you can be healthy at any size, health at
Yeah.
every size. So you're refuting that. You're saying no,
Yeah.
eventually this is going to catch up.
100%. I mean, you could say that, there are some people who could climb Mount Everest without oxygen, and there are some people who are, just now we just had the longest woman who ever lived who smoked every single day just passed away. Well, then why don't we all smoke? Just because there's exceptions to the rule, it doesn't make it the rule.
Mhm.
And there are going, and she probably lived a very hopefully carefree life. Maybe she wasn't having other general stressors, or maybe there was something with her genetics, or maybe there was something else. But you cannot look at one person or very few individuals and then make that the general rule, right? If we looked at like the billionaires and then just made the general rule off of the wealthiest people in the world, that just it wouldn't make sense. So you can't make rules off of the outliers. And we have learned that obesity means certain disease processes. There are some people that won't, but overall, most people will.
Could we add that not everyone who is obese or overweight wants to lose weight, and that has to be okay?
So,
Not everybody is comfortable with putting themselves on an injection or in any way addressing their body size.
yeah,
I'm sure there are a lot of reasons for that. One of the reasons is people have been stigmatized for being fat their whole lives. And there's a backlash of people saying, I'm not going to take it anymore. I'm fat. I'm big. I'm going to be myself. I'm going to live my best life. I'm going to be healthy to the best of my ability, but I ain't going to do one damn thing about weight loss. So I think there's a continuum of the people who hear you and go, yay, sign me up, bracha,
yeah,
and the people who have a valid argument,
yeah,
a valid reasoning for not
yeah.
wanting.
So there's another aspect that I would like people to think about where, well, what we're talking about is the metabolic health. So what you're seeing is like, oh, okay, why do I need to lose weight? But what we're thinking about when I talk about visceral fat, I'm talking about, I go a layer deeper. What I'm talking about is something called metabolic health. And your metabolic health is directly correlated to how long you will live for. There's other ways to improve your metabolic health. It's, how you're eating. It's the type of foods, processed food. It's muscle building. The more muscle you have, the better metabolic health you will have. So there's a combination to, what we're saying. It's not just okay, I want to lose weight. It's also looking at this and saying, how do I become metabolically healthy? And the answer to this, and what I always see, is the things that you want to recorrect in your life are something called your glucose and insulin. If you correct your glucose and insulin, you will fix everything else underneath it. And how do you correct your glucose and insulin? It's working out, lifting weights, building muscle, eating healthy, walking, all those different things that we talk about. Sleeping, affects your hormones and processing and emotions and all of those things. And so when I talk about these drugs, I want everyone to think a little bit more than just about, and yes, we're talking about is any size healthy. And to me, the answer is no, but it's not just about how you look, it's about what's happening underneath inside your body. And that's the perspective that I'm also like, I want people to think about. And when I think about GLP-1s is when you look at an iceberg and you see the part that you don't see is the strong part, which is underneath the water. And that's kind of like our metabolic health. Like you don't always see what's going on, but that's like the most important part of your body. And so I'm just offering a different perspective to when we
Mhm,
think about weight loss. I
mhm,
think it's not so much about um, the size anymore. It's about we're shifting towards a place where we want to improve our metabolic health.
mhm,
Um,
mhm,
because that is overall going to determine how long and how well you will live for. And sometimes it takes years for the metabolic dysregulation to start coming out in different forms as what the medical team decided to call that a terminology, meaning sometimes it will take years of metabolic dysfunction before someone has something called diabetes. And that's kind of like something that I urge people to think about, that it takes a long time and your body is really good to you. You know, like you could be drinking alcohol for years before your liver decides to give you a problem, years. And so I want to shift the focus to self-love of loving your body. You know, let's love our body, because if you truly love your body, true love is not affirmation or confirmation. It's not telling another person, yes, yes, yes. That's not true love. It's really having the courage to really stand up and articulate what you believe is correct. And so I think we should just love our body. Like it's the opposite. And I hope these drugs bring that out to be like, let's love our body a little bit more because of
mhm.
this this change this drug is making in our body, because it's fixing something underneath that we can't necessarily see. And you know, the whole big thing with the real-time feedback and how it changes our brain. But I think there's a perspective of self-love here, of
Yeah,
doing, yeah,
yeah. I like that you're moving in that direction because I think that one of the things that we need to add in a discussion like this one is something called self-compassion. Food is love. Food is celebration. Food is socializing. Food is so many, so many deep, joyful things in
yeah,
our life. And to become more aware and more in touch with how much food or do we really need all that food is a loss. And
yeah,
sometimes people have to grieve. And this is one of my favorite topics. They have to grieve the fact that food cannot be the only game in town. Food cannot be the only love relationship. Food cannot be the only way you have to calm and comfort yourself. It can be one of the ways. But let's just say how hard that is because food is cheap, food is available, food is legal, food is abundant. So it's socially accepted that people get together and eat. With Thanksgiving coming up, let's throw that in. And I
yeah,
think compassion for the whole struggle of food and inflammation and fat and female
yeah,
and
yeah. Yeah, and it's not like why someone chooses to go for a second portion or why someone just chooses to eat certain foods or binge eat. It's just so not someone's fault. There's so many deep layers to your decision in eating. It's so deep rooted. Same type of thing. Again, I always go this compare the to relationships, because relationships are very also emotionally rooted. Why you choose certain partners, it's so deep rooted, and there's a deeper psychology behind it. And so, you know, no, most people don't look at when they choose the wrong partner, they don't really blame themselves. They look at their life and they unfold different things about why they chose that. And I think I wonder if we could look at that relationship of when we choose certain type of partners, why we choose food, like if like unpack that the same
right,
way.
right.
there's not I mean, I don't think there is as much shame as when we choose the wrong partner. It's more just, uh, how do I deal with
Therefore,
yeah, yeah. So I think
if
there's
we
something
choose the wrong partner, we get to say it's their fault.
yeah,
We don't have to take responsibility.
yeah. And so I also do want to add that I actually while these drugs are revolutionary for chronic obesity or helping people lose weight, um, I don't only use these drugs for that because I believe they have many other benefits. I mean, I personally went on it to lose 15 pounds because I felt better in my body, 15 pounds less, and I gained the weight and I couldn't lose it. And so I think there's, while we're talking about this, there's many other reasons why people go on these medications. We use it for people to stop drinking or to stop smoking. And it's not only if you have chronic obesity, although that is what it got FDA approval for, but I believe that people could go on it just because they want to have better control over the type of foods they eat or how much food they eat, or they just want more control over their food choices. And this drug does that for them. It also, if they just want to have better metabolic health or improve PCOS or menopausal weight gain, right? And so there's so many other reasons why someone can go on this drug, not just if they're struggling with obesity. So I do want to add that because we do focus on many other things than just that aspect. Yeah. Um, I know we wanted to take some questions, so if anyone has any questions, then we will answer them now. And let's see, someone said, Marianne, how many of us have hidden and snuck food over the years, right? We've all done it, myself included, birthday cake, can we just have one? Let me try one thing. And like, I don't want anyone to see because I'm on a GLP-1. And there's shame to it, even in myself,
I
like everyone.
I think I told you that I had a patient who would hide food in the hamper, and she lived alone. So
Wow,
who
that's
was
a
she
lot.
hiding from? It was
Right.
fascinating. She lived alone, and she would hide food in the hamper.
Yeah.
So she must have had a voice of parental scolding her, still very alive inside, and there went the food into the hamper.
Yeah.
People are really marvelous at the
Mm.
creative ways they have as you said, trying to take care of themselves. It's
Yeah.
marvelous.
It is. Yeah, someone wrote, I totally agree with what you say. I continuously sabotage my weight loss when I start getting compliments from men. Um, and that's like a little bit on that topic. Um, Obesity is not the same as overweight. You put them all in the same category and are using them interchangeably. It could be that we're using a little bit interchangeably here when I was talking about the different things about visceral fat and metabolic health. Um, and whether you have obesity or you're overweight, just a different level of metabolic dysregulation that's happening. So that's
Was
my
that a
answer.
question, was someone saying as a question about
Um,
sabotaging? Can you say more about the sabotage?
I know she was just saying a comment that she would sabotage her weight loss when she started getting compliments from men. You want to speak on that?
Yeah, like for the next hour?
Okay.
I've written 4 books on emotional eating, and I talk a lot about the fear of success because with success comes new expectations of oneself and one's relationship. And definitely, food for many people or fat can be an armor, preventing them from venturing out in ways that are uncomfortable for them. So, to get to the root of that, you have to ask yourself, what would happen if you were the weight that you wanted to be? What would come up for you? Why does a compliment from a man throw you into a tizzy? Is he going to expect more? Is he going to take advantage of you? So I've come up with about 11 different fears of success. Let me just say another one. If your whole life has been worrying about your weight, what you eat, how many calories, are you going to lose it? How should you lose it? And then all of a sudden, it becomes easier through these injections. What's going to give your life meaning if you can no longer obsess about, oh, me, my food, my weight, my this, my that? What's going to give your life meaning? And this is where I think grief also comes in, that when you give up that identity of me as a compulsive, anxiety about weight and eating type person, you're going to have to be creative. You're going to have to face that it's a loss. And then
Yeah.
the other loss is if you're able to do it now, then I should have been able to do it before. That is a regret I hear all the time. I feel so bad that I can do it now because I should have been able to do it before. And I tell people that the timing was right now for you and it wasn't before. We can look at why if you're curious about that, but let's acknowledge that the time is right now.
Yeah.
Congratulations.
That's good.
Yeah.
Um, Someone commented, let's partner with our bodies and work with them, right? So that's so important. And GLP-1s really you should have it. It's really your best friend if you allow your body to work with it and listen to it. What is your take on children using these drugs? So first of all, they're only it's from 12 and above. It's an interesting topic. I don't want to get into it too much now. I'm not sure if we have enough time, but and Marianne, you'll say your perspective on it. I think there's so much psychology when children are growing up that have obesity. I would say there's something more to think about. I would never put a child on it to lose like 10 pounds. I would put an adult on it to lose 10 pounds, but I would never do that. We don't work with children when it comes to GLP-1s in general. It's out of my scope. But I think there's so much to that because if you're bullied as a kid about being overweight, I think that is going to hurt the child long term.
Yeah.
Um, and then there's also, you have to tread lightly if you're putting a child on this and what's the psychology and what they're understanding about it. And I think it's something that you need a full medical team when you're doing this, Marianne.
Yeah. And the other question is for how long? Is this kid going to need to be on it for the rest of their life? I think it's a very conflictual area. And again, I think the answer is it depends on the individual child.
Yeah. Yeah. Well, on a medical perspective, your fat cells are determined based on like the first 12 years, and the amount of years after that you have obesity, you have higher chance of having more insulin resistant, which will make it harder for you to lose weight when you're older. Like the more years you're overweight, the harder it is to lose weight. And so that's another perspective. Like if you allow a child to go from 12 to 17 and then put them on the drug, then you gave them 5 more years of insulin resistance and you actually will cause their journey to be longer. So it's actually like a very complex question. And I don't think there's one size fits all. It's very complex and
Mhm.
it's definitely a struggle, like of course for a parent to make that sort of decision with their kid. Um, Clinically, what does Ozempic do relative to food choices or food quantity? Not sure if I understand the question.
How does it work? How does it make you eat less, maybe?
So it makes you eat less so you have GLP-1s in your body, in your gut, and your intestines, actually in your brain. And then when you eat food, all of those peptides get triggered throughout your body for anywhere between a couple minutes to 10 minutes, 15 minutes, that it makes you feel full. Then we got these peptides, then we change the shape of it, and now it lasts for a full week. And so essentially what it's doing, it's staying in your gut for longer because it's slowing down your GI tract. So you're feeling more full. And then it's also quieting the food noise and doing something in your hypothalamus, which is telling you that I don't have this strong need anymore to go after things that are pleasurable for me, for instant pleasure. So for example, sugar, carbs, smoking, alcohol, all of those instant pleasures that you may have in life, it suddenly says, I'm not actually going to work that hard to get it. I feel satiated with less. So now, usually if you have 2 slices of pizza, you may have a few bites and then that satiation was already filled. Or you may wait up till 1 o'clock in the morning for your Uber Eats to come, but now you're not going to. I'm sure Uber Eats has less sales. You may go downstairs, you may go downstairs to your lobby and go across the street to have a cookie because you want one at 11 o'clock at night. But when you're on these medications, that desire gets less. We can go into what else that means, but that's kind of
So
like makes a different decision. Yeah.
I have seen with people that they have less interest in alcohol. You mentioned that before. I have a patient on Zepbound who is a marijuana smoker daily, and I keep listening to see if it's changed for them, and so
Yeah.
far not. So far not.
I'm watching a couple patients on, I'm curious about that. I don't have an answer if it's going to um affect that decreased craving with the marijuana. It does it for like instant gratification. I'm not 100% sure if it lights up the same place in our brain. Okay, so we're watching. We don't have an answer
Right,
yet.
right, right,
Yeah.
right.
Um, what happens when you get off the drug? Okay, so first of all, when you get off, you need to be careful when you go off of it. So taper down, just like taper up. Um, Most 80% of people regain the weight. That's the truth. Those are studies. And then there are people who don't. I think people who go on these medications to lose 10, 15, 20, 30 pounds may keep the weight off. I think if you're going on it to lose 100 pounds, it's going to be very hard for you to keep the weight off. Remember, you have to change your body set point. It takes about 12 to 18 months to change your body set point. And so if you go on these medications, lose 30 pounds in 4 months, and then you go off of it, or even if you lose less, if you lose 20 pounds in 4 months and you go off of it, you're probably going to gain the weight back because your body set point didn't change. So you need to be
Uh,
long enough. It's almost as like, I always make a joke because, if you try to go to the DMV and you have to apply for something and it takes like years, your body's like as slow as the DMV. Like it takes time to register that there's a change now. And so we have something it's called the thrifty genes theory, where in the past, people who were thin died, and if your genes mutated to hold on to fat, and those are the people that lived. It was survival of the fittest. And so we have certain genes that will make us live longer if we hold on to fat. And we, over time, through generations, think about like the people who went through starvation camps. The genes that were able to hold on to fat lived longer. So our bodies, we always go back to our bodies do things to protect. When you try losing weight, your body will start protecting you and hold on to the fat as much as possible because it wants to save you because you're starving. And so you need to change your body set point for it to be like, oh, 1 second, we're not sorry. So what happens when you get up the drug? It depends how long you've been on it for. It depends on why you went on it. It depends on how much pounds you lost and how long you're on it. So there's many different things, but and
and the
also
changes you've made along the way, the
100%.
changes of self-care.
Of course, obviously. Yeah,
Yeah.
there's so many studies that show people who went on the drug with lifestyle changes and without lifestyle changes, and the people who, when they went off the drug, that didn't do any lifestyle changes. I mean, it's almost like guaranteed you will regain the weight back, and also do the emotional work. It's not just the gym what you changed in terms of what your diet is, but why were you doing all the things, the emotional work,
Right.
realizing I'm eating because I'm anxious, right? Like all those
Right.
different things.
Awareness plus action equals results. So
Yeah.
can I
Yes,
can I
let's talk about that.
so I've just published my fourth book. It's called Ozempic for Smarties. And I learned and have learned and continue to learn so much from Braha. And I filtered through my perspective of psychology, and this is through the lens, this book through the lens of psychodynamics. Like I said before, fat can be a family issue, and fat is more than an individual issue, it's a relationship issue. And I talk in the book about who can benefit and who cannot, and also about the controversy about health at every size and whether obesity is a relapsing disease. And I quote an article, this was in the New York Times Magazine, about a woman who asked the question, can I be a fat activist and still want to lose weight? And I thought that was like very touching.
Yeah.
Yeah.
Yeah, that's cool. Well, I'm like really excited for your book.
And
I
Raha, I thought you were going to show us yours.
it's not out yet, but at the end of the year you'll be able to pre-order. So the talking about the instruction manual that was never given to people before they go on these medications, which is probably the biggest issue of these meds, that we don't understand it and how to use it. And there's not enough practitioners. There's not enough practitioners out there that truly understand the drug.
Right.
Yeah.
And many primary care physicians will give it to you because you've asked, but
Yeah.
they don't know how to raise it, how to lower it, and everybody who's listening, Bracha is the encyclopedia of everything having to do with GLP-1s. So when her book comes out, and mine, together with mine, this will be a very comprehensive lesson in the magic and the helpfulness of these
Yeah.
medications.
Yeah. I have one more question here I'll answer and then we'll wrap up. Someone said, I use trizepatide. I love it. Can you explain the two different types of medications? And so in trying to answer that question under a minute, you have two different type of medications. There's Ozempic, and then there's some semaglutide, Ozempic, Wegovy. Those are one category, and then there's trizepatide, Mounjaro, Zepbound. That's another category. And so this category over here, usually I use it for people who have habit change that needs to happen. They usually have less weight to lose, and they want to also help with like certain binge eating, smoking, drinking, some sort of, we're working a little bit more in the brain versus the GIPs, which are like Zepbound, Mounjaro, trizepatide. Usually, and I don't know if you're in either there's chronic obesity or there's menopausal weight gain, works much better. Usually, if I put a woman who has menopausal weight gain, 8 to 10 pounds, that needs to lose weight on Ozempic, she won't lose weight as well as she will on a GIP, which is like trizepatide, Mounjaro, Zepbound. So these classes more for when when your habits are out of whack, and then there's these one, it's what I call your hormones are out of whack. Hormones are like insulin resistance, chronic obesity, menopausal weight gain, and that's how I separate the two different meds and how I usually prescribe it. And so they're different drugs essentially. The next class of drugs are retatrutide, which are supposed to be even better than the other two, but we don't know yet, and we'll see. And it's not out yet, meaning they're off-label use, but it's not out in terms of FDA approval. I believe that whatever it is, the future of these medications will just continue to get better and detect a little bit more and be more isolated. So we'll have less side effects because we'll be able to perform and do a better job at making these medications. So with that being said, I want to say thank you so much for, making the time to do this, Marianne.
Right.
You're so educational, you're so informative, you're so helpful. It's so important when people go on these medications that they have so many different components to their journey. It's not just going on the meds, it's not just having, us to guide them and help them lose the weight and dosing, but it's also important for them to go deep and understand a little bit more. And so I really appreciate, you constantly sharing your knowledge and education.
I really appreciate you. This has been a good team. I have a question. Do I have a chance to ask a question?
Yes, of
And
course.
and this may not be appropriate for right now, but if you had a client who is bulimic and doing very, very well, had reached the maximum semaglutide, doing really well, and then started not doing so well. Some of the food noise came back, some of the bulimic behavior came back. What would you do? Is this an appropriate
Yeah,
question
we can
for?
talk. Yeah,
Yeah.
it's a great question. I would also look about like what their physical health is. And so let's say their physical health, everything's good. It's just the food noise and the urges came back. Um, I would then probably it wasn't working. Um, I would switch them to trizepatide at that point. If I maxed out on semaglutide, I would
Yes.
switch to trizepatide. It may
Okay.
not work as well, but it may also work. I've seen because I've also seen people stop smoking and drinking on trizepatide, and so likely it's the same place that gets lit up in our brain that's happening with the purging. So, trizepatide will be my second drug of choice for something like that. Because once you max out on the dose and you grow tolerant to it, the thing with I would wait for them to get maxed out on that dose before I'd move them over because if you don't max out and you just go to another. So if you switch from drug to drug, then you grow tolerant to the medication much quicker. And so I've seen
Mhm.
patients do that. They'll go from semaglutide, then they'll go to trizepatide, and then they're like, I actually like semaglutide or vice versa. And let's say they were on 1.5, 1.5 won't work anymore. Now you have to go to 2 or 2.5. And so when you're on a drug, if it's working, you max out on that one before switching to a different med unless it's not working for you. And also it's like people who go on and off of it, like go stay on it for a month and go off of it, you also grow tolerant to it much faster. And so that's how I'd probably handle the case if everything else was fine.
Got it.
With,
Mhm.
yeah.
I have one more thing to say. We could go on. I've been to a lot of webinars lately, like every webinar I can get to on Ozempic, I go to. And I feel that everybody, the nutritionist, the therapist, they all make the same mistake. They say that food noise is hunger. And if you feed yourself enough food, you won't have food noise. I do not believe that is true.
Okay, so
I have heard that over and over and over again.
yeah.
Food noise can be emotional. This girl is obsessing about food because she doesn't want to think about her grandfather having molested her. That's not hunger.
Yeah.
That's emotional protection. So I just
Yeah.
wanted to say I've heard this over and over and over and over again, and it
Yeah.
bears clarifying.
Yeah, it's definitely not the same thing. We have food noise all the time and we're not hungry. And there are some people that live with food noise their whole life and they actually just think it's normal and they find it fascinating that other people don't think about food.
Mm-hmm.
And there are people that are probably don't realize that their body's hungry and they go out all day without eating. They're busy and they just don't have food noise and they don't eat.
Mm-hmm.
So there's the other aspect of people who just don't think about people who never have food noise. There are some people that never, I mean, I didn't have food noise most of my life, until I gained weight. I never had food noise. I never thought about food, but I felt hunger. And one thing, the difference between doing like gastric sleeve or bypass is that a lot of these people that go through these surgeries, they can't eat. Um, and they're still hungry though. So,
Mm-hmm.
and it's just interesting the difference between these medications that it is these GLP-1s are taking away food noise and hunger, which you didn't get with the previous type of like surgeries that help people lose weight. They couldn't eat, they were just starving. And probably also thought about food, but these medications are, yes, taking away both. They are, but you could still have one without the other. And also on Ozempic, you still get hungry. If you're at the right dose, like you should get hungry. And just
Right,
because you're getting hungry doesn't mean you're getting food noise, you
right,
hopefully you get hungry on these drugs, they're not meant to cut your appetite, they're meant to
right,
suppress it. That's
right.
a bad thing, by the way. If you never hungry on these medication, big problem. And so you should feel hungry on these medications, but it should still decrease your food noise. And it's not, it doesn't go hand in hand.
Mm-hmm. Mm-hmm.
Yeah,
Okay.
great. Thank you so much,
All right. The
everyone,
pleasure.
for your time.
Thank you, everyone, for coming.